could be anything from asthma to dyspnea, maybe in a child who has bronchitis or RSV. Just refer to it as difficulty breathing, dyspnea. The inability to breathe begins with a capital A, apnea, and this is something that we'll be talking about tonight, apnea. The inability or cessation of breathing. So when we look at true apnea or apneustic events, we most commonly refer to it as sleep apnea or cessation of breathing during the night. Usually you hear about people who've been on a sleep study. They're actually measuring their oxygen saturation or O2 saturations during the PM. Normally your oxygen saturation in your red blood cells should be greater than 95%, and what they'll measure then are those events that go below that or less than that high. When we see an apneustic event then, or a cessation of breathing, it will actually measure out on a graph, and that sleep study will show then periods where a person actually goes into a cessation of breathing, and then their oxygen saturation will drop down, and their brain then perceives them starving or deprived of oxygen. So you'll actually see, if you've ever been by someone who has apneustic events, they'll actually, you'll hear them kind of alert or alarm themselves or almost come out of sleep. The most common signs of apnea, though, are not those alarming events that you see. What you'll often see is unexplained weight gain and difficulty with weight loss. You'll see symptoms associated with reflux and heartburn. And then they'll always describe then that I just feel tired. I always feel tired. The other thing that very, very commonly is associated with apneustic events is an elevation in blood pressure. So they'll actually have hypertension. And there was a study that was done where a doctor actually took a group of men who had high blood pressure and during the day would actually put them on oxygen. You just have them with little nasal cannula. They're on oxygen, okay? And these weren't old folks with a little can pushing the can around, right? They're just men who had high blood pressure. And in every one of their cases, he was able to bring their blood pressure down just by giving them oxygen during the day. So someone said, well, let's actually take a look back. Is it possible then that these people are not breathing during the night and are therefore oxygen deprived, and that's why their blood pressures are elevated? And the answer was yes. In every one of these cases, these were apneustic events where they had sleep apnea. And so the treatment was to give them oxygen when they were sleeping. That's where then we get the forced oxygen masks or the nighttime CPAP machines. Okay? Anybody know someone that's on a CPAP machine?
Yep. Seems like the latest craze anymore. It's the
Yeah.
phones.
Yep, everybody's on a CPAP, huh? We went hunting in Alaska, and this guy actually had specially shipped in 2 giant diesel batteries, diesel truck batteries, to run his CPAP machine. He needed his sleep, and at night, here we are in this wall tent. I'd never had a CPAP machine running by me all night, but it was pretty interesting. Listen to this guy, just get this whole mask on and go to sleep. He was the only one that slept. That was great. But it's changed his life. So most people, when they see CPAPs, they just can't stand it, because it literally is. It's a mask that fits tightly over the face. You've got a band that goes up high and a band that goes down low, and most of the guys that try to wear them just I think I'm going to go crazy, and they have a tough time with it. Has anybody, a family member or someone that you know that has CPAP? A few people, okay? Now, let's actually talk about what's occurring beyond just this O2 saturation change, and talk about some of the things that lead to a change in the ability to breathe during rest. Okay, does that sound fair? Let's actually look at a couple of things first. Everybody good to this point?
Are headaches a symptom of
They can be.
apnea?
Yeah, they definitely can be. This definitely was not an exhaustive list, so
Oh,
yes,
okay.
headaches. Bruxing and TMJ, sometimes that will be also. Because just before you awaken, 5 minutes before you come out of a restful sleep, the last muscles to engage are your masters, your muscles of mastication or chewing muscles. So all of a sudden you're aware that you're starting to kind of move your mouth and move your teeth, and you become aware of your jaw location and positioning. And that's just 5 minutes before loss of, or coming out of restful sleep. If you aren't ever getting into restful sleep and you're finding that you're just all night grinding, potentially you're dealing with sleep apnea, because your brain's trying to go into that and then it's coming back out, and it goes into and then it comes back out. Those muscles are trying to relax and they come back on, out and come back on.
And sorry, I have a speech problem here with this.
This is Dr. Robertson.
I have this thing in my mouth.
This is an appliance.
Yeah.
Everybody can have them too.
Very often the tongue is just too far back from jaw position.
And that's where we're going right now. Exactly. So what we're going to look at then is causes of that sleep apnea and obstructed airway. Okay, so let's talk about this first. When the person is upright, we won't turn the whole board, we'll just draw it this way first. So when the person is upright, what you'll find is that in the back of the mouth, in the airway, we actually see that if we could look inside, this airway is created here by the nasal cavity and then the oral cavity. In the back we have the oral pharynx and the nasal pharynx that join, and then it goes straight down into the bronchial tubes, bifurcates at the carina, goes into the lungs. And what we're really looking for then is this airway to be patent or open. So when a person is upright, remember commonly when we were, our generation was to, in the child, if they got an obstructed airway, it was always, the procedure was a T, an A, right? T for tonsils, A for adenoids, okay? Because these lymphatic tissues would get swollen, and my little child would be snoring all night or have recurrent strep infections, because here's the ear canal, which drops into what's called the meatus here at the posterior portion, right behind the tonsil. And so this area actually gets blocked by this in this retropharyngeal space. Basically it's like a box, and this auditory meatus comes right into that box. When it gets swollen, it pinches off and causes then an ear infection, right? Or pressure in the ear. So what's our solution? Take out the tonsils or put tubes in the ears, right? Well, that's not our solution, but that's what is recommended, right? Actually, one of the best treatments for that is ear insufflation with ozone, right? We can actually treat just by putting ozone through a little ear cannula, just hanging some little stethoscope hooks in the ears and just running that, and it actually will reduce the swelling here and kills the infection and opens the airway back up for the child. Okay, isn't that nice? So we don't have to do surgeries anymore? No. In fact, these tonsils right here, the adenoids are a lymphatic tissue, the tonsils are lymphatic tissue, so is the appendix, a lymphatic tissue, the spleen. All of this alimentary canal, not just the respiratory canal, the whole canal is actually riddled with lymphatic tissue. So by pulling out the tonsils, have we really remedied the lymphatic swelling? Absolutely not. There still is a problem. Yes, we did remove the obstruction at the posterior pharynx, okay? But again, there are many things that can be done long before we have to do that. In fact, when we look at ear infections, there is a homeopathic called Otoplex that's been researched very well in Europe. And for most ear infections are viral, not bacterial. Viral infections are treated, yes or no, with antibiotics?
No.
Absolutely no. Viruses are not even alive, so how could an anti against bios, life, how could an antibiotic kill a virus? It can't. The virus is already dead. It's not living. So it becomes viral or active when it actually impregnates or pierces. So we have this naked protein with a little gene in it that has then this little capsid that will land on our cell, inject its viral DNA or RNA, depending on what type of a virus it is, and it has to actually use our gene and our genes to replicate, and then it gets to a certain point that it produces, and then it causes what we call cell lysis, and these then produce new viruses that go out into the body. Okay? But those aren't even technically alive. That's not anything more than like a spore or a seed. And it has to actually use that. Most of your infections are caused by viruses. Antibiotics against life, antibiotics, do not treat your infections. Okay? So we use a